Hello guys, in this video we are going to study about galactose and fructose metabolism disorder, a topic from biochemistry. Many questions are asked from this particular topics and they're very easy topics. So first of all, we have to get an overview of the galactose and fructose metabolism. In fructose metabolism, first of all there is fructose, right? Now fructose will become fructose 1-phosphate through an enzyme known as fructokinase. Of course you must be knowing it, through an enzyme known as fructokinase. Now fructose 1-phosphate, as you can see over here, fructose 1-phosphate will become glyceraldehyde and DHAP, will become DHAP and glyceraldehyde, right, through an enzyme known as aldolase B, Similar type of thing can be seen in galactose metabolism also. First of all, galactose will come and it will become galactose 1-phosphates. First of all, phosphorylation is done of both these products, right? So what is the enzyme? Again a kinase will be there, and what type of kinase? Galactokinase will be there, galactokinase, right? Now galactose 1-phosphate will become glucose 1-phosphate through uridyl transferase, as you can see over here, will become glucose 1-phosphate through uridyl transferase, galactose uridyl transferase enzyme, right? So first of all, we have four enzymes, right? One is galactokinase and fructokinase. These are similar type of enzymes, and the other type of enzyme is uridyl transferase and aldolase B, which is actually converting 1-phosphate forms to developed forms or the further forms of these particular products, right? So first of all, you have to understand a basic thing, right? That is, if for example galactokinase deficiency or fructokinase deficiency is there, if there is galactokinase or fructokinase deficiency, first of all what will happen, that it will be a mild disorder, right? It will be a mild disorder, right? It will be a mild disorder. If galactose 1-phosphate, if galactose is accumulated or fructose is accumulated, it will only cause cataract like symptoms, right? Because these particular products, galactose and fructose, will accumulate in the eye, right? Accumulate in the lens, it will accumulate in the cornea, and hence it will cause cataract or corneal opacity. Mainly it will cause cataract, and it will be mild disorders. Why? Because phosphate is not trapped, right? Phosphate is not trapped, right? In uridyl transferase deficiency and aldolase deficiency, phosphate is trapped. Can you understand it? Since fructose 1-phosphate and galactose 1-phosphate are already made and they cannot convert into glucose 1-phosphate or DHAP and glyceraldehyde into their further products, that's why phosphate is trapped. In case of phosphate is trapped, it will cause liver dysfunction, right? These particular products will be formed and accumulate in the liver. That's why it will call liver dysfunction. It can cause hepatomegaly. It can cause failure to thrive, right? So these particular features will be present, right? Whereas in case of galactokinase or fructokinase deficiency, nothing will happen. It will be a mild disorder and only cataract will be present, right? And in fructokinase, cataract will also be not present. In fructokinase deficiency, nothing will happen. If I tell you what will happen, nothing will happen. It is so mild disorder. Okay, so for example, if in a question you are given that the patient has cataract, the patient has no hepatomegaly, no liver dysfunction, and no failure to thrive, everything is all good, then what type of enzyme deficiency it can be? It can be either a galactokinase deficiency or a fructokinase deficiency, right? You have to approach this particular question in this manner. If the question is telling you that the liver dysfunction is present, hepatomegaly is present, and failure to thrive is also present, then what will be the disorder? The disorder will be either of uridyl transferase deficiency or will be of aldolase B deficiency, right? So now how will we understand that if the question is giving me mild disorders, then how will I understand that the answer will be galactokinase or fructokinase deficiency? Actually it is very easy. Now you have to understand it, right? See, what is the basis? In galactokinase deficiency and fructokinase deficiency, the difference is based on presentation time, the presentation time of these two disorders. These galactose metabolism disorders, since galactose is present in breast milk, that's why the time of presentation will be at the time of birth or few days after birth or at the time of birth, whereas fructose is present in fruits and external sources, right? Fruits and external sources. That's why when do we give fruit and external food products to babies only after 6 months. So that's why the presentation will be at 6 months of age, right? This is the basis between these two. Differentiate, how will you differentiate? For example, a question is giving you that the patient has mild symptoms, right? The baby is having mild symptoms at birth, right? At birth, then what will be your answer? First of all, mild and at birth means mild symptoms at birth. Mild symptom means that a DD should be galactokinase or fructokinase deficiency, and at birth, so what happens at birth? It is galactokinase. So the answer is very easy. The enzyme disorder over here is actually galactokinase deficiency. Next symptom is, next question I'm for example giving you, the patient has failure to thrive. The patient has failure to thrive and lack of milestones. Lack of milestone developments. Lack of milestone developments also has hepatomegaly, right? Also has hepatomegaly. And all these symptoms are occurring at 6 months of age. Before 6 months of age there were no symptoms, right? So what will be your answer? First of all, the patient is having heavy symptoms like lack of milestones, failure to thrive, hepatomegaly, which means that your answer will be either iridyl transferase deficiency or aldolase B deficiency, right? And how will we differentiate? At 6 months of age, by the duration. At 6 months, what happens at 6 months of age? It can only be fructose metabolism disorder. So if this is a fructose metabolism disorder, right, and big enzymes are involved, which means aldolase B will be your answer. Aldolase B is your answer. Another example I'm giving you, patient is having cataract and normal symptoms, right? Nothing else is at present, and it is occurring at 6 months of age, right? What will be your answer? It is very easy. First of all, the patient is having cataract only, right? And normal symptoms are present, and only normal symptoms are present at 6 months of age, right? So only normal symptoms are present means mild symptoms are present. That means that it can be either galactokinase or fructokinase deficiency, and it is occurring at 6 months of age. What occurs at 6 months of age? Fructose metabolism disorder, which means that galactokinase will not be the answer. The answer will be fructokinase. So the answer will be fructokinase deficiency. This is an arbitrary question I have made. Generally in fructokinase deficiency, cataract will not be present, right? So that's it, guys. I have completed this topic. Just I want to complete it from the first aid photo I have given over here. It is a very easy thing. We will complete it fast. First of all, essential fructosuria and hereditary fructose intolerance and galactokinase deficiency and classical galactosemia. All these 4 disorders are based on these 4 enzymes, and all these 4 enzyme disorders are actually autosomal recessive disorders. So first of all, essential fructosuria. It involves the deficiency of fructokinase. We all know that, right? If you are deficient in this particular enzyme, this will lead to essential fructosuria. It is named essential because nothing happens in this particular disorder, essential fructosuria. That's why. Autosomal recessive condition, I already told you, all these 4 are autosomal recessive condition. Benign asymptomatic condition, right? Since fructose is not trapped in the cell, that's why it's a benign asymptomatic condition. Symptoms: fructose appears in blood and urine, right? So this is it. Now hereditary fructose intolerance. Now hereditary fructose intolerance is a deficiency of aldolase B, right? If you are deficient in this particular enzyme, right, so it will cause aldolase B deficiency disorder, aldolase B, and the name of the disorder is hereditary fructose intolerance. So already you can understand that if aldolase B is deficient, then the symptoms will be large, right? Heavy symptoms will be present or major symptoms will be present, and the symptoms will, since it is a fructose metabolism disorder, the symptoms will be present at 6 months of age, right? Not at birth. So here we can read it. Autosomal recessive, already told. Fructose 1 phosphate accumulates, causing decrease in available phosphate, which results in inhibition of glycogenolysis and gluconeogenesis. Following consumption of fruit juice or honey, since fructose is only present in external sources, urine dipstick will be negative, very important. It is positive only for glucose. Sugar can be detected in the urine, non-specific test for inboard carbohydrate metabolism. Hypoglycemia, jaundice, cirrhosis and vomiting. Already told you that liver problem will be there. Cirrhosis, if it is given cirrhosis and jaundice and hypoglycemia, it cannot be a mild symptom, it is a major symptom. Treatment: decrease intake of the fructose, sucrose, glucose plus fructose and sorbitol, right? So everything is explained it over here. Right, now coming to disorders of the galactose metabolism. Galactokinase deficiency. If your enzyme deficiency is over here, right, galactokinase is deficient, then the disorder is known as galactokinase deficiency, again autosomal recessive. Galactitol accumulates if the galactose is present. Now see, already told you that galactose returns to galactose 1 phosphate through galactokinase. If galactose is accumulated, then actually it will not stay there like that. It will, with the help of aldose reductase, it will convert to galactitol. And what will galactitol do? Galactitol accumulates and galactose is present in that. right? Galactitol will enter the lens of the baby or somewhere else, and it will cause cataract, right? Galactose appears in blood, galactosemia, and urine, galactosuria, infantile cataracts, right? Cataracts will be developed, may present as failure to track objects and develop a social spine, right? It is a benign condition, told you, right? Ki fructokinase and galactokinase deficiency are mild or benign condition disorders. Now coming to classical galactosemia. If you're deficient in this particular uridyl transferase enzyme, this it will lead to classical galactosemia. The absence of galactose 1-phosphate uridyl transferase, autosomal recessive condition. Damage is caused by accumulation of toxic substance, including galactitol in the lens, right? In this particular disorder, in lens also the galactitol will accumulate, and galactose 1-phosphate will also accumulate in the liver, right? So infant lactose from the breast milk and routine and failure to thrive, neonates, jaundice, hepatomegaly, infantile cataract, intellectual disability. You can understand these by the symptoms that these are not mild disorders, these are major disorders, right? And very important, a question was once asked from pedia that in neonates, in case of classical galactosemia, what is the enzyme, what is the organism that causes sepsis? The answer is E. coli, right? So you have to remember E. coli. Treatment is, of course, you have to remove galactose and lactose from the diet. So this is everything, guys. You have to remember nothing very hard about this particular topic. It's a very easy topic. You only have to remember these 4 enzymes. You have to differentiate between mild and moderate symptoms, and then you have to mild and major symptoms, and you have to differentiate between the timeline. This is all you need to know about this particular topic, and questions will be done only by this particular example or this particular principle, right? So you can try questions on Marrow or other apps, whatever you like, and questions will be made very easily. Thank you.